Many believe the HIV epidemic is over, but people in our community, they're still testing positive every single day. In fact, many are positive right now and just don't even know it. The good news is that HIV is treatable and preventable. Joining us now is DAP Health Medical Director of Specialty Programs, Dr. Jason Halperin. Welcome, doctor.
Hey, Thalia, thank you so much. I'm so happy to be here.
Yes, an important topic. Many people think HIV is a thing of the past, doctor, but it's not, right?
So that's true. What is amazing is we have incredible treatment, but it is not a curable disease, and it still remains life-threatening. So we still see new diagnoses almost daily in our community. So it has not gone away, even though we have incredible treatment.
Okay, now why is it important that everyone get routinely tested for HIV?
Well, we are all at risk for HIV. And HIV is a virus that when you first contract it, you can be completely asymptomatic for up to 10 years or even longer. So if you're not getting routine testing, you will not know you're living with HIV, which means you can become sick, but you can also transmit the virus. But once you are tested, and if you are living with HIV, we can get you on treatment immediately that day. Your life expectancy will be no different. You'll live a long, healthy life. And once you are on treatment, you cannot transmit the virus to anyone.
Wow. Okay, so if someone tests positive, they start treatment right away.
Yeah, we try at DAP to get you in same day, and we will start you on medication same day, because as soon as you're on medication, we are controlling that virus. So that makes sure you're living a healthy, thriving life. And once on treatment, you can't transmit the virus to anyone you love. It's miraculous.
Wow, quite improvements, right? So somebody who may be HIV negative but wants preventative tools, what do you have to say to that?
Yeah, we are also in a brand new world in terms of prevention. So everyone needs to get tested. If you test positive, we start you on treatment. If you test negative, we talk about risk, and there are medications, either one pill once a day, or now even injections every 8 weeks, or even every 6 months, and it 100% prevents HIV. So it's really a miracle. There should be no new HIV infections at all. We have incredible treatment and prevention.
So you're saying you wouldn't even have to protect yourself, say you engaged with somebody who is HIV positive, if you take preventative measures while you're negative?
So that's a great question. So one, if you're having sex with someone living with HIV and they're on medication, there is zero risk of transmission. It's so the safest person to have sex with is someone living with HIV. If you are at risk and maybe you don't know the status of your sexual partner, then the medications prevent HIV. They don't prevent other infections like gonorrhea, chlamydia, and syphilis. So using other forms of protection might be necessary, but the medications prevent HIV, and it's really incredible. Very well tolerated, very easy to take. We love to start these medications at DAP.
Doctors have come a long way, that's for sure. What do you want viewers to remember from this interview, doctor?
You know, it is important for me, for everyone to know that we all are in this together. We all have a status. We all need to be tested, determine if we're living with HIV, and if so, start on treatment immediately. If not, and there's any risk, we have medication that prevents HIV, and we then need a political will. We need to push to make sure these medications are accessible for all of our community members.
Well, we certainly learned a lot this morning. Thank you so much, doctor, for your time.
Thank you so much.
If you think you might be due or overdue for a checkup, the best next step is to talk to a clinician. Call 760-323-9255 or visit daphealth.org to learn more or schedule an appointment.